Part 4 of this presentation describes the logical data structures that support the planning and delivery of therapy programs in both the subacute and community settings. The logical data structures that support the planning and delivery of therapy programs in both the subacute and community settings are shaded in mauve in this diagram. These data objects will be described in the next few slides. But before we get into that discussion, let's briefly summarise the stroke care objectives of the three major phases of a normal stroke recovery journey: the acute care phase, the subacute care phase, and the community care phase. As a stroke survivor moves slowly along his or her stroke recovery journey, acute care clinicians need to determine what brain structures and brain functions have been affected by one or more ischemias or hemorrhages, and what medications or medical procedures are needed to stabilise the survivor's medical condition and reduce the likelihood of further brain damage and stroke episodes. Once the stroke survivor is transferred to a subacute setting, specialist stroke rehab therapists need to assess what actual physical, mental, cognitive and emotional disabilities have been caused by those stroke events, and plan and implement therapy programs that target the disabilities that need to be overcome before the stroke survivor can be safely discharged from hospital and back into their community. And when the stroke survivor is discharged back into their community setting, community-based clinicians and therapists need to plan and implement therapy programs that target disabilities that need to be overcome in order to return the stroke survivor's quality of life to an acceptable level. The Stroke Rehab app can assist in the acute, subacute and community phases of the overall stroke recovery journey in a number of ways. It can assist in the assessment of a stroke survivor's disabilities by first defining stroke event disability objects, which match each significant disability with the stroke event that caused it. This relationship can be expressed in the following way. A stroke event may affect many abilities or emotions, and an ability or emotion may be affected by many stroke events. And second, by defining disability linkage objects that recognise that emotional disabilities may be indirectly caused by stroke-related physical, mental, cognitive and communication disabilities. This relationship can be expressed in the following way. A stroke event disability may cause many stroke event disabilities, and a stroke event disability may be caused by many stroke event disabilities. And third, by recognising the need to prioritise stroke event disabilities so that the disabilities that impact most on a survivor's capacity to live safely in the community or to experience an acceptable quality of life can be addressed as soon as possible. This is important because there is not necessarily a direct correlation between the severity of a disability and its impact on a survivor's quality of life. So therapists must be aware of which disabilities are causing the greatest impact on a stroke survivor's safety in the community and quality of life, and that this perception may change over time as the stroke survivor travels along his or her stroke recovery journey. The Stroke Rehab app can also assist the overall stroke rehabilitation process by helping clinicians and therapists to select appropriate therapies and to plan their delivery. Because, as we saw earlier, the central database contains therapy target objects, which, hopefully, represent up-to-date, evidence-based, clinical best practice, and which clinicians and community-based therapists can access to receive expert guidance in the selection of therapies that most effectively treat specific physical, mental, cognitive, or emotional disabilities. This knowledge is expressed in the following relationship. A therapy program may target many abilities or emotions, and an ability or emotion may be targeted by many therapy programs. The central database also contains stroke event functional map and stroke event disability objects, which represent the knowledge of neurologists about the brain injuries suffered by a particular stroke survivor and which clinicians and community-based therapists can access to obtain expert guidance about which therapy programs work best on a particular survivor's brain injuries, and maybe whether it is possible to stimulate neuroplastic changes to overcome those brain injuries. The Stroke Rehab app can also keep a record of the decisions specialist stroke therapists or community-based therapists make when they prescribe particular therapy programs to address specific disabilities suffered by individual stroke survivors. And facts about what therapies are prescribed by whom, for whom, and why can be expressed using stroke event therapy program and therapy program target objects, as illustrated in the following relationships. A person acting as a therapist may prescribe many stroke event therapy programs, and each stroke event therapy program must be prescribed by one person. A therapy program may be prescribed in many stroke event therapy programs, and each stroke event therapy program must prescribe one therapy program. A stroke event may be treated by many stroke event therapy programs, and each stroke event therapy program must treat one stroke event. A stroke event therapy program may target many stroke event disabilities, and a stroke event disability may be treated by many stroke event therapy programs. Finally, the Stroke Rehab app can keep a consistent and coherent record of a stroke survivor's recovery in the acute, subacute and community settings. The stroke survivor's recovery progress can be recorded and monitored by ensuring that a stroke survivor's abilities, as represented by their ICF-D codes, and emotional states are fully assessed and recorded in the relevant stroke event disability objects, both prior to discharge from either their acute care or subacute care hospital and at appropriate intervals following discharge into the community until the survivor's quality of life has reached a satisfactory level. These stroke event disability objects can then be used by therapists to track an individual stroke survivor's recovery through time and well beyond their discharge into their communities, to decide if therapy programs need to be modified, stopped, or a new therapy program commenced, and to transfer detailed knowledge of a stroke survivor's recovery progress to other therapists or clinicians who may be better equipped or more conveniently located to continue the treatment. And finally, hospital administrators, research workers, and health planners will be able to perform statistical analysis of stroke event disability objects to assess the effectiveness of particular therapy programs in targeting particular disabilities, to assess the effectiveness of particular therapy programs in repairing brain damage, to assess the ability of particular therapists to prescribe effective therapies, to learn more about how the brain recovers from injuries, to identify a need to develop more effective therapies for particular disabilities, to identify a need for new or improved therapist training programs, to identify a need for therapists to be encouraged to set up practice in places that are currently underserviced, such as in regional or rural areas, and to select past stroke survivors for newly developed therapies or case studies. To summarise this section on the stroke therapy data object classes, We have seen how these data object classes represent the knowledge of subacute care clinicians and therapists about the physical, mental, cognitive, communication, and emotional disabilities associated with each ischemia or hemorrhage. Which therapy programs have been prescribed to target specific disabilities, and any emotional disabilities that might adversely affect the capacity of stroke survivors to rebuild their post-stroke lives. This knowledge is not only important in determining appropriate subacute and community care therapies and treatments, it is also important in transferring appropriate knowledge and experience to clinicians and therapists operating in a community setting, particularly in regional and rural areas, and building evidence of the effectiveness of various therapies in treating different disabilities.